Hello, I'm Joan Justice with HealthWorks Collective, and I'm here today with Dan Munro. Dan is a healthcare writer for Forbes, and he's also the CEO and founder of iPatient, a website which is helping to transform the patient-provider dialogue. In a recent article, Dan commented that the real challenge ahead isn't so much about pricing itself as about value. That's what remains a real mystery. Dan, I'd like you to talk a little bit about value here.
Sure. And thanks for taking the time and visiting today. Um, yeah, it was an important article in part because there's so much focus today around the idea of transparent pricing. And I wanted to get a little bit deeper on that subject relative to healthcare and how that fits into the value equation, because it's really challenging to simply work backwards from visible or transparent pricing. There are solutions that are starting to materialize relative to getting visible pricing. And one of those I don't know if I referenced this one, but there's a surgical center in Oklahoma that actually publishes on the web a price list for almost every sort of minor and some major outpatient surgeries that they provide. There's a huge disclaimer at the front end of the website that says these are our prices. If we have to file insurance on your behalf, these prices do not apply.
Yes, of course, yes.
So it's a real interesting spin on what I reference as sort of the leading edge of where we're headed with pricing. What we have to be careful of, though, and that's really the larger issue behind this, is how do we determine as consumers or patients, how do we arrive at what's true value for the healthcare spend? And right now, much of what we wind up spending relative to healthcare is simply really expensive, and it's continuing to escalate. So arriving at value is a lot harder than simply looking at price. And I'll give you the example that I like to cite, because I haven't found this quite in the wild yet, but I know there are cases where a local outpatient lab facility could provide, say, an MRI, and they may be able to charge $80, $90, $100 for a simple MRI. And if you compare that to, for example, a hospital, and the MRI inside a hospital is, say, $800, there's a huge discrepancy there in price. What we haven't determined is what the value difference is between those two as they relate very specifically to our own healthcare needs. And that's where pricing is certainly the first step in the equation, and it's an important one. But I argue that it's not the only one, and ultimately it's not the one that we need the most. What we need to get to as quickly as we can is two things. First of all, we need to get to that value equation relative to price, and there are instances where the $80 MRI may make a lot of sense, and there are other instances where the $800 MRI inside a hospital is perfectly legitimate and appropriate. So that's a key element of the value equation. But then behind that is also the notion that we need to get an alignment between all of the stakeholders, not just us as consumers and patients, but all of the stakeholders aligned around the idea of lowering costs across the board. And that is an industry problem that is very complex, difficult to solve, and one that we'll be working on for the next few years ahead.
Yeah, a lot of work to be done, Dan.
A lot of work, and that's not to say that it's not doable. It is to say that I'm not sure that we've reached that tipping point yet where we have all of the stakeholders aligned around a value equation. We're starting to see it first and foremost with pricing, but I'm also concerned that there's a tendency to treat patients more and more as consumers. And I'm really concerned about the notion of that because it sets the stage for a very different dialogue that puts it in the realm of shopping.
Mm-hmm.
And I'm really cautious about that approach because I don't think healthcare falls into the same category as other shopping services.
Mm-hmm.
And some of that we're already seeing pushback. I know that Yelp has a service for consumers that helps you, provide feedback on healthcare services. And the pushback from that has already been significant on the part of providers who have sued patients for bad reviews under Yelp. And so what that suggests is that maybe that's not the right dialogue. Maybe that's not the dialogue that's the most helpful in the sense of getting to the value equation that we all need. Because shopping for healthcare services simply alludes to the idea that if we don't like response A, whether it's a pricing variable or maybe it's a recommendation that we need to engage to our own healthcare benefit, I don't want to set the stage where we simply say, okay, I don't like that response, I'm going to find a different one. Because that's not a part of the value equation that I think we need to try and get to.
So what advice would you give patients to try to get to the value?
Yeah, so there are some interesting sort of next generation solutions that are coming online. Yelp is one that I've tracked a little bit, and then there's a couple of others. One's out of New York called Vitals, and they have a service that's exclusive to healthcare practices and getting feedback in a consumer way. And then I know that ZocDoc, also in New York, recently added, I think, some elements of that capability in the sense of being able to rate and rank doctors based on patient experience. And that's an important element because part of what ZocDoc is tied to, which is really interesting, is the scheduling side. And part of what we're looking for in the sense of patients is a new model that treats our time with equal value. I'm not sure that has happened a lot in healthcare in the past.
No, it sure hasn't. I've had some discussions with doctors about that.
Right. And so ZocDoc is in an interesting position to help with that because they're already handling the scheduling. And so they're elevating the importance of scheduling to both sides of the equation. And that is where you start to see interesting value in a new way for the healthcare equation.
Very interesting. Well, thank you so much, Dan. I think it's important to realize that it's not only visible pricing that's important here, but visible and true quality value as well. And thanks for bringing this to our attention. I really appreciate it.
And thanks again for having me today.
Okay.